Can you see my slides?
Yes,
Yeah.
Podo.
Okay, so let's start. Okay. Slideshow. Okay. Okay, so this would be your lecture on the pelvic cavity and neurovascular structures found within the walls of the pelvic cavity. Okay. So the lecture is basically divided into the structures that form the pelvis and the blood vessels and the nerves that are found or located in the wall of the pelvic cavity. Okay. So first, where do we find the pelvis? Okay. Now the pelvis is the region of the body that's located between the trunk, okay, and the lower extremity. Okay. So between trunk and lower extremity, that's where we find the pelvis. Okay. And the bony pelvis, okay, is likened to a basin. Okay. Basin, the container of water. No? You will look at the shape of it. Okay. Parang it would be similar to it. Okay. Now, we know that we are in the region of the pelvis if we are able to appreciate the following surface landmarks. No? From the iliac crest, okay, anteriorly, you have your anterior superior iliac spine. If you follow the iliac crest posteriorly, you are in the posterior superior iliac spine. Okay? Then in the midline, you have the pubic tubercle, which is the bony projection of the superolateral border of the pubic bone. And of course, the articulation of the two pubic bones in the midline, the symphysis pubis. Okay? So when you see these surface landmarks, you know that you are within the area of the pelvis. Now, the pelvis is made up of course, the bones. Okay? So the bony pelvis is made up of two hip bones, the two hip bones, okay? The two pubic bones coming from each side, articulating the midline, the symphysis pubis, and the ilium, okay, or the two hip bones, the alar process of the ilium, articulating with the alar process of the sacrum, okay, forming now the bony pelvis. Okay. Now, of course, you include there the coccyx, which articulates with the sacrum. Okay. So this is now the bony pelvis. It's formed by the articulation of the two hip bones. If you recall, your hip bone on one side is made up of three bones, right? The ilium, the pubic bone, and the symphysis and the ischium. Okay, so all these three bones form your ox coxae, meaning the hip bone on one side, and articulated with the sacrum and the pubic bone in the midline, forming this ring shape, okay, or as I say, basin shape bony pelvis. Okay. Now the pelvic region is divisible into two spaces or two parts, what is known as the falls or the greater pelvis, and what is known as the true or the lesser pelvis. Okay, since we said that the pelvic region begins even here, no, at the region of the iliac crest, no, diba? All the way downward here, no, to the ischium. Okay, then you have a quite a big part known as the pelvis. Okay, so that's why it's divisible into the false pelvis and the true pelvis. Now, the false pelvis is the one that we see here above. Okay, what is the superior part of the pelvis, okay, or pelvic region, while the true pelvis is the inferior part dito sa baba. Okay. Now, what separates the false pelvis above from the true pelvis below here, which is the space inside, no, this pelvic inlet, is the pelvic brim or the pelvic inlet. So this point or this area, okay, is what is known as the pelvic brim or pelvic inlet, and this is the demarcating line. Okay, everything above, no, the pelvic brim is the false pelvis, or superior to the pelvic brim is the false pelvis, while inferior to it, sa baba ng pelvic brim, is the true pelvis. Now, because of the size difference, no, the false pelvis is called the greater pelvis, so mas malaki kasi yung space, no? And your true pelvis is smaller, that's why it's called the lesser pelvis. Okay? But in our discussion, this is basically what we are going to concentrate in okay? The true pelvis, the one that is found below the pelvic inlet. Okay? Okay. Now, what are the borders of the false pelvis or boundaries? We say laterally you have the ilium, okay, and the iliac fossa, where your muscle is attached there, the iliacus muscle. Posteriorly, you have the lumbar vertebra, kung may you have your L5 here, no? Lumbar vertebra. And anteriorly, okay, okay, look at the anterior boundary of the false pelvis, the anterior abdominal wall. Okay, so why is the anterior abdominal wall of the false pelvis made up of of muscle instead of bone? No? Why? Because in the in the body, no, the pelvis is slightly tilted forward, no. Medyo nakatilt siya paharap, okay? So that this pelvic inlet, no, this opening here to the true pelvis is not facing upward. It's actually facing slightly forward or anteriorly. Okay? So since nakatilt anteriorly ang pelvis mo, okay, what is occupying this front portion of your false pelvis is muscle. Yung like your rectus abdominis. No? So yun na siya ng landyan. Okay? Okay? Although the lateral and posterior are still here, the boundaries are still made up of bones. Okay? Okay. I'm sorry, can you see my pointer? Can you see
Yes,
my pointer?
po.
Okay
Yes.
naman. Kasi I might be talking to see my pointer. Okay. Now, since the pelvic inlet or the pelvic rim is an important demarcating structure, then we have to describe what the pelvic inlet is or the pelvic rim. It is this portion here, no, formed by the sacral promontory, the iliopektinial line, and the symphysis pubis in the middle. Okay? Iliopektinial line on the other side, sacral promontory. Okay? If you have seen the sacrum, no, as it articulates with L5, okay, you will notice that this edge of the sacrum is it's a slight forward curve, sabihin na natin, no? And that is the sacral promontory. Okay? Now, if you go lateral to the bony pelvis, you will see this ridge-like elevation of the iliac bone. Okay? All the way up to the anterior, no, yung ridge-like elevation in the superior rami of the pubic bone. Okay? Yung call this the superior edge or the ridge of your pubic bone here. Okay? Or even the pecten pubis. Okay? Okay, you connect this ridge here with this ridge here, then you have the iliopektinial line. Okay, and in the middle, the articulation of your pubic bone is the symphysis pubis. So this entire, shall we say, ovoid, okay, shape, pelvic inlet or pelvic brim is what delineates the false pelvis above from the true pelvis below. Okay? Now, on the other side or the other end of your pelvic cavity, you have the pelvic outlet. Okay? And in the pelvic outlet, okay, you have different set of bones there that forms it. Okay? You have the ischial tuberosity on each side. You have the tip of the coccyx posteriorly and anteriorly. You have this inferior rami of the pubic bone, or what is known as the pubic arch. The pubic arch. You will notice that in this picture, here, this slide, the pubic arch is quite rounded, okay? And this is the pelvis of a female, okay? Because this slide, quite rounded shape pubic arch, okay, is a characteristic feature of a female bony pelvis. Okay, we will see that as we compare the male and the female bony pelvis. Okay, this one. Okay. So we'll start with the male pelvis, your bony pelvis on the left, the female on the right. Okay. As we would surmise that the you have a heavier set of bony pelvis in the male and lighter in that of the female. Okay? The sacrum in the male is narrower. So ito yung width. It's narrower as it would be broader in the female. Okay? Your greater sciatic notch. Okay? Greater sciatic notch in the male would be deeper and narrower, shallower and wider in the female. The iliac fossa is deeper in the male, anyway, but the iliac fossa is still in the greater in the false pelvis, even if it's shallower in the female. Yeah. Okay. Now the ischial spine, okay, is more projecting, mas matulis daw. Yeah. In the male, as you would compare it to the female, okay, less projecting. Okay. Now the ischial tuberosity, okay, is inverted paloob, no, in the male, while it is everted palabas in the female. Now, the ischial spine, no, the less projecting the ischial spine is, no, uh, it is more. Then you would think that the space in between the two ischial spine would be wider, as you would compare it if the ischial spine is more pointed or more projecting. Okay, then you have the space in between the two tips of the ischial spine would be narrower. Okay, now in the female, that is quite advantageous because the space that is at about the level of the ischial spine is about the mid-pelvic plane. Okay, and remember that during childbirth, okay, the head of the baby passes through, okay, the pelvic cavity, through pelvis, and this space here is one of the areas that the head of the baby will pass through. Okay, so the more projecting the ischial spine is, the lesser space you will have there. Okay? And up and it's a characteristic in the female pelvis that you have a wider space there because of the less projecting ischial spine in the female, thus more conducive for childbirth. Okay, okay. The symphysis pubis is longer in the male, shorter in the female, and this one, yung subpubic angle, the one that I described earlier, right, in the pelvic outlet. Okay? Na you have a wider and more rounded, okay, subpubic angle. Ito po, ito. Okay? Yung nasa baba na yan. More rounded in the female, and you will compare to a more angulated, okay, sharply angulated, okay, subpubic arch in the male. Again, more conducive for childbirth. Okay? Okay, the superior aperture, ito po, yung opening na to, yung what we describe as the pelvic inlet. Okay? Yung shape daw niya in the male is heart shape, while it is oval shape in the female. Again, another feature conducive for the passage of the baby's head during childbirth or parturition. Okay? The major pelvis, though narrower in the male, wider in the female, and the minor pelvis, wider in the female, narrower in the male. Ito na, yung minor pelvis, ito, yung lesser. Yan. Wider naman daw yan sa female, okay, dito, comparing to the male. Okay. The capacity of the minor pelvis or the true pelvis is greater in the female, lesser in the male. Okay? And that rightfully so, because in the true pelvis of the female, okay, you need more space there because the uterus is an additional organ found in the female pelvic cavity. Okay? Okay, aside from the rectum, urinary bladder, may uterus ka pa doon. Okay? So you have a greater capacity of the minor pelvis. Okay? All right, so now let's go to the composition of the walls of the pelvis or the pelvic cavity. Okay? You have what forms the walls of the pelvis? You have bones, you have joints, ligaments, membrane. Okay? Okay, lined within by muscles and covered by fascia. Okay, so from the inside of the pelvic cavity, your muscle is covered by your parietal layer of pelvic fascia. Okay, okay, so that if you enumerate layers of the pelvic wall from outside going in, you have bones and fibrous tissue, or fibers, the muscular layer, and the fascial layer. Okay, now this is a sagittal section, okay, of your bony pelvis. Okay, showing now the ligaments, and the membrane. Okay, okay, this is your obturator membrane here covering the obturator foramen, except in the superior portion. This part, okay, of the obturator foramen is not covered by the obturator membrane, nor is it covered by muscle or fascia. It remains open, okay, because this part of the obturator foramen becomes the obturator canal. Okay, and it is important for the passage of blood vessel and nerve. Okay. Also included is your sacrospinous ligament and your sacrotuberous ligament here. Okay. Sacrotuberous, sacrospinous, converting your ischial, your greater and your lesser sciatic notch into a greater sciatic foramen. Okay, so opening na siya. Okay, and a lesser sciatic foramen. Okay, okay. What about joints? Okay, when bones come together or articulate to form joints. So you have the joint between the sacrum and the coccyx, the sacrococcygeal joint. You have the symphysis pubis, which is the articulation of the pubic bone here in the midline. You have your sacroiliac joint between sacrum and iliac bone. It's quite well supported by ligaments, your anterior and posterior sacroiliac ligament. Okay? You have also the lumbosacral joint between L5 and your S1, okay? And the coccygeal joint. Okay? The ligaments, okay, these are support. They are structures that basically support the joint. Okay. Now in this the sacrotuberous ligament are important ligaments in that they, like I said, they demarcate or they basically form a part of your greater and lesser sciatic foramen. Okay, without the ligaments, the foramen will not be formed, and you will just have a notch there. Okay. Now the two foramens, the greater and lesser sciatic foramen, since it becomes an opening, no, structures will pass through them, no, from the pelvic cavity going up. Okay, this one, that's your meron din. Okay, it passes through them. Okay. Now, it said that the sacrotuberous and sacrospinous ligament, with their attachment to the pubic, to the sacrum, okay, basically would maintain the slightly tilted position of the pelvis or bony pelvis, okay, so that the ligaments would prevent, any further movement of the pubic, the pelvis, okay? Any further tilting of the pelvis, okay, from its position because of the attachment of the two ligaments. Okay. Okay. Now you also have your iliolumbar, okay, extending from the transverse process of the lumbar vertebra going to the in the crest. Okay. Okay, now let's go to the membrane. We have the obturator membrane and the perineal membrane. Okay, we will not discuss the perineal membrane. What is important, the perineal membrane is that it is the demarcating structure between the superficial and the deep perineal pouches. Okay, and we will be discussing the perineal membrane when we go to the lecture on the perineum. Okay, so going back to the obturator membrane that I described earlier, okay, this opening here that remains patent, okay, becomes the part of your obturator canal. And what passes through that is the obturator artery, vein, and the obturator nerve. Okay? Okay. Now let's go to the muscle that forms the wall of the pelvic cavity. Okay? So the muscle, let's describe the muscle as being located either on the lateral side of the pelvic cavity, posterior side of the pelvic cavity, or on the anterior, or on the floor. Okay, so we will discuss the muscles of the pelvic cavity in that manner. Okay. So we start first. So what do we see on the lateral wall? What muscle do we see on the lateral wall? Of course, you will be obturator internus muscle. This one. Okay. Now the obturator internus, okay, is attached to the rim of the obturator foramen. Okay, part ng origin niya. Okay, rim of the obturator foramen as well as the obturator membrane. Okay, then its insertion is landing insertion greater trochanter of the femur. So the muscle is found inside the pelvic cavity, but it inserts outside the pelvic cavity. It inserts to the femur. Okay? So initially, the obturator internus muscle is wide here inside the pelvic cavity, but it will sort of taper, when it narrows into an almost tendon-like structure, so that it exits the pelvic cavity via your lesser sciatic foramen, and it will attach itself to the greater trochanter. The nerve innervation of the obturator internus is the nerve to the obturator internus, and its action is on the lower extremity. This muscle forms part of the pelvic wall, but its action is on the lower extremity. It is a lateral rotator of the femur and an abductor of the femur when the hip is flexed. Okay, now the obturator internus muscle is covered by a fascia on its interior side or on its inner side, okay, on the side of the pelvis, okay, pelvic cavity. It is covered by a fascia. It's known as the obturator internus fascia. Okay. Okay. Now, the obturator internus fascia is fuses with the periosteum of your pubic bone, and in a certain in its lower part here, the obturator internus fascia thickens or kumakapal siya. Okay. The thickening of the obturator internus fascia is, described is called now your arcus tendinous, okay, or the tendinous arc. Okay. So the thickening of the obturator internus fascia inferiorly is known as the arcus tendinous. Okay. Now the fascia, like the muscle and the membrane outside it, okay, again does not cover that opening there, because that opening again, as I said, becomes the obturator canal. Okay. Now, the obturator internus muscle and its fascia that does not end here inside the pelvic cavity. It actually extends inferiorly downward so that it forms the side wall of the ischirectal fossa. Now, the ischirectal fossa is already in the perineum. Wala na po ito sa pelvic cavity. It is already in the perineum. I have a slide, the coronal section of the pelvic cavity, so that I can show you the ischirectal fossa. Okay, in the following slides. Okay, but suffice to know that this fascia and even the muscle will continue downward into the perineum to form the side wall of the ischirectal fossa. Okay, another muscle that this time found on the back or posterior side of the pelvic cavity, that's the piriformis muscle. That one. Okay. Okay. Now its origin would be from the second to the third, okay, sacral vertebra. And its insertion, okay, then, similar to the obturator internus, it goes out of the pelvic cavity. Lumalabas po siya. Okay. This muscle, again, wide in its point of origin, but as goes distally to the near to the point of insertion, it again will taper, okay, to a narrower size of a muscle, and it exits this time via the greater sciatic foramen. Okay, kanina yung obturator internus exits via the lesser sciatic foramen. This time the piriformis goes out to the greater sciatic foramen. And again, it will insert to the greater trochanter of the femur. Okay, so similar to the insertion of the obturator internus, but as you know, the greater trochanter is a big prominence. No? Malaki naman yun yung structure na yun. So you have a different point of insertion in the greater trochanter of the for the obturator internus, another point of insertion for the piriformis. Pareha sila sa greater trochanter pero magkaibang specific location. Okay? Innervation of the piriformis is from the first to the second sacral nerve, and because of its similar point of insertion, the action would be similar to obturator teres muscle. Okay? All right. Now let's go to the floor. Okay? So natapos tayo sa lateral wall, sa posterior wall. Now let's go to the floor or the inferior, okay, wall or side of the pelvic cavity. Now the muscle that closes off this opening, okay, okay, kung walang muscle yan, butas yan. Okay. What closes off this opening is the pelvic diaphragm. Now, the pelvic diaphragm is a term, okay, collective term for two groups or two muscles, the coccygeus and the levator ani muscle. Okay. So when we say pelvic diaphragm, we include both coccygeus and levator ani muscle. Okay. Now, the levator ani muscle is the bigger part of the pelvic diaphragm. Yung coccygeus masyadong maliit na muscle lang ito. Sometimes some individual it degenerates into, it's like a ligament now. We discussed in a little while, no? But the levator ani muscle is the wider, makes up the wider part of the pelvic diaphragm. In fact, the levator ani is even described as having sets of muscle fiber: the iliococcygeus, the pubococcygeus, okay, and the puborectalis muscle. Okay. Now, the distinction between these three group of fibers of the levator ani is not it has not well demarcated. Eh, kung titingnan nga natin yung levator ani, parang isang muscle lang. But it is described as having three component muscle. No? Yung iliococcygeus will be the most lateral, so to say, and more superior. Okay, the lower part, we say, lower group of fibers would be the pubococcygeus. Again, moving more medial. Okay? And the most medial or most inferior of your levator ani group of muscle fiber would be the puborectalis. Okay? Now you will notice that the puborectalis is this part of the levator ani muscle, the one that is closest to the wall of the rectum. Yeah. Okay? That's the puborectalis muscle. Okay? And with the contraction of the puborectalis muscle, this, you can imagine the puborectalis is forming a sling around the rectum. Okay? And nag-perform siya ng sling around it. Okay? From its attachment here to the pubic bone, it goes around, okay, the wall of the rectum. Okay? Now, because of this position of the tuberculosis, no, with the contraction of this muscle, yung normal tone lang anong muscle na yan, okay, it pulls on the rectum. It pulls it forward, okay, anteriorly, so that this muscle creates an angulation between the rectum and the anal canal below. Okay? So ito, pag kinontinue mo yung rectum downward, it becomes your anal canal. Continues as the anal canal, which is the terminal portion of the GI tract. No? Now, with the pull of this muscle, it creates an angle between the rectum above and the anal canal below. Okay? Now, the coccygeus, going back to the smaller part of the pelvic diaphragm, the coccygeus, okay? This one, a small triangular shaped muscle. Okay? Its origin is from the ischial spine. Okay? And its insertion is to the sacrum of the coccyx. Okay? So baliktad yung kanyang attachment, kagaya ng kung yung piriformis natin ang origin niya sa sacrum, yung coccygeus mo, ang insertion niya is sa sacrum and its origin is from the ischial spine. Okay? Now, the coccygeus, because of its relatively small size, no, it does less movement, okay, and contributes less perhaps to the action of the pelvic diaphragm. So wala siyang masyadong contribution to the action to the function of the pelvic diaphragm. Okay. So that in some individuals, it even degenerates, no, to form part of what is known as the sacrospinous ligament. So in some individuals, parang nagiging part na siya ng sacrospinous ligament. Okay? Kasi nga, maliit na muscle lang siya. Okay? From the ischial spine to the sacral coccyx. Okay? Now you will notice also here, the arrangement of the muscle, component muscle of the levator ani is not flat. Ganun. Okay? But rather it's sloping downward. Ganun. Okay? So mas mataas yung iliococcygeus, the next is slightly lower, the pubococcygeus, and the most inferior of the levator ani muscle fiber group would be your tubericularis. Okay? Okay. Now, this is the coronal section of the pelvic cavity that I mentioned earlier. Okay? The pelvic cavity is here, this part, this space. While this is the pelvic diaphragm now. So everything below the pelvic diaphragm or inferior to the pelvic diaphragm is already perineum. This is the perineum. And this triangular shape or pyramidal shape space here in the perineum is your ischiorectal fossa. I told you that I will show you the ischiorectal fossa, and this is the space. It's already in the perineum, and look at the side wall of the ischiorectal fossa. It is made up of the obturator internus fascia and muscle. So the muscle from the pelvic cavity continues downward into the perineal region to form the side wall of the ischiorectal fossa. Now, the pudendal vessel and nerve, okay, are these group of bundle of structures found coursing underneath the obturator internus fascia. Okay, okay. Now, origin of the levator ani muscle. You see that there are component muscle, no? Iliococcygeus, pubococcygeus, and tubericularis. Now, the attachment of the levator ani muscle from anterior going posterior would be the pubic bone, anteriorly. Okay? The most posterior would be the ischial spine. Now, in between them is the arcus tendinous. I mentioned earlier, the arcus tendinous is a thickening of the obturator internus fascia. Diba? Now, that thickening is an important point of origin for the levator ani muscle. So, hindi lang pala siya thickening o kumakabit pala yung muscle doon. Levator ani muscle also attaches or has a point of origin from the arcus tendinous. Okay? Now, the insertion of the levator muscle will be in the midline. The medial raphe, okay, specifically the anococcygeal ligament, and it attaches also to the coccyx and to the anterior and sacrococcygeal. Moving on, the levator ani muscle is innervated by your lower sacral nerve and the inferior humeroidal nerve. Okay? Function of this levator ani muscle. Okay? Muscular support for the pelvic muscle. Remember, in the pelvic cavity, you have urinary bladder, the uterus, the rectum. Okay? Whenever we strain, okay, whenever we increase intra-abdominal pressure during the time of straining, during defecation, there is a tendency for this pelvic muscle to go down, the pelvic organs to go down. No? Pwede siya mag-prolapse, no? Into the pelvic outlet. Okay? But with the presence of the pelvic diaphragm there or the levator ani, it supports those organs, okay, visceral organs, so they do not move downward during straining. Okay. Now, another more specific action of the levator ani is that it constricts the rectum and pulls it forward. So, anong part ng levator ani yung nagpo-constrict sa rectum? The muscle fibers that's closest to the rectum, that's the tubericularis. Okay, it constricts the rectum and pulls it forward so that there is now an angulation between the rectum and the anal canal. Okay, assist the abdominal muscle to increase intra-abdominal pressure during defecation and forceful respiration and vomiting. In the female, the sphincter vagina, okay, which is important during childbirth. because it supports the baby's head as it passes down through the pelvic inlet. So it supports the baby's head as it passes through the birth canal. Okay, but actually the vaginal canal, okay, this one during childbirth becomes the birth canal. So the baby's head passes through the birth canal. It is supported by the levator animals. Okay. Okay. Now notice that the pelvic diaphragm, although it basically closes off, not the pelvic outlet, or it closes off that opening of the bony pelvis. No? This part, itong anterior part na to ng floor of the pelvic cavity remains open. Hindi po ito natatakpan ng pelvic diaphragm. This is known as the urogenital hiatus. Okay? What covers that part is the urogenital diaphragm. Okay? And this will be discussed when we go to the perineum. Okay? So that part is not covered by pelvic diaphragm at all. Okay. Okay, now we've finished with the posterior, lateral, the pelvic wall, the wall, the floor of the pelvis. Now the anterior part of the pelvic wall, you basically have bones there. Pubic bone, pubic rami, and simplus pubis. And as a review again, the posterior wall is made up of piriformis muscle, the parietal layer of pelvic fascia, the sacrum, and the coccyx. Going to the lateral wall, you have, of course, the muscle, the obturator internus muscle, the obturator internus fascia and membrane, the sacrotuberous, sacrospinous ligament, and of course the hip bone. And on the inferior, the all-important pelvic diaphragm, dividing the pelvic cavity or separating the pelvic cavity from the perineum. Now this is a sagittal section, not a mid-sagittal section of the pelvic cavity with the visceral organs in place. Okay, so the pelvic cavity it's like a big, it's like a space, single space there, in pelvic cavity. But if you put the different visceral organs inside the pelvic cavity, now you subdivide that big space into smaller spaces. Okay, as defined by the presence of the different visceral organs. Okay, so urinary bladder, it's the rectum, urinary bladder, rectum, and in the female, you have the uterus and vaginal canal. Okay, so you have spaces in between these visceral organs. So we will describe these spaces as being part of as being subspaces within your pelvic cavity. Okay, okay. So let's go to the different pelvic spaces. You have your retropubic space of rectus, okay, which is this part here, found immediately posterior to the pubic bone but anterior to the urinary bladder. Okay. You have your this one. You have your retrovesical space, meaning behind the urinary bladder but in front of the rectum. Okay. You have your prerectal space, again behind the urinary bladder in front of the rectum, but it is located below. It is located below the retrovesical space. The retrovesical space is up here. Yung prerectal space is down here, okay, behind the location of the prostate. Okay. You have your presacral space, so in front of the sacrum and posterior to the rectum. Okay. Now the presacral space is where we find some blood vessels, emerging from the sacral region, going towards the area at the back of the rectum. Sometimes during the section of the rectum in rectal in surgeries involving the rectum. Okay? You have to be careful that you are in the right plane, okay, so that you do not cause undue bleeding during your dissection. Okay, all right. Now let's go to the blood vessel. Okay? Blood vessel, nerve. We'll start first with the blood vessel. Okay. Now most of the most of the blood vessel that goes into the, not all the blood vessel that goes into the pelvic cavity comes from the internal iliac artery. Internal iliac artery is one of the two terminal branches of the common iliac. Okay, the other is the external iliac. Okay, the other is internal. External iliac becomes the femoral artery below the inguinal ligament. The internal iliac goes into the pelvic cavity. Now, the internal iliac has two divisions: a posterior division and an anterior division. Okay, the posterior division, it gives off branches that goes to the wall of the pelvic cavity, while the anterior division gives off branches that that go and supply the visceral organs within the pelvic cavity. Okay, although some of these branches go out to the pelvic cavity, okay, some of them supply the visceral organs. Okay, so let's go to the different branches of the anterior division first. Okay, first, in the female pelvic cavity, you have the obturator artery here, emerging from the anterior division. Okay, and if you follow the obturator artery anteriorly, okay, it does not supply any structure inside the pelvic cavity, but rather it goes out via the obturator canal, okay, and it goes down into the lower extremity. Okay, okay. Now, in some individuals, there is what's known as an aberrant origin of your obturator artery. Sometimes the obturator artery will not come from the internal iliac, but rather it comes from the inferior epigastric artery. Okay, so that's a normal variant. Okay. Another is the umbilical artery. Okay. Again, another branch of the internal iliac. Okay. So if you follow it, it will go over the dome of the urinary bladder and will give off this branch, the superior vesicle. After giving off that branch, the umbilical artery continues to the abdominal wall here on the posterior side of the abdominal wall and becomes obliterated as the medial umbilical vein. You have the uterine artery, again another branch coming from the internal iliac. Okay, and one of the branches of the uterine artery is the vaginal artery. So galing sa uterine yung vaginal artery. You know, some books may say that the vaginal artery may arise directly from the internal iliac. Okay? But we have what usually we find the vaginal artery as arising from the uterine. Okay? Now, an important distinction in the male is that there is no, of course, vaginal artery. Okay? But what replaces this vaginal artery in the male is the inferior vesical artery. Inferior vesical artery, okay, which is found only in the male and basically replaces the vaginal artery. You have the middle rectal artery, another branch, okay, of the internal iliac, and you have the internal pudendal artery here. Okay. You follow the course of the internal pudendal artery. It goes out via the greater sciatic foramen and it enters the perineum via the lesser sciatic foramen. Okay. So, hindi lang natin masyado makita yung greater and lesser sciatic foramen here. But this artery is an example of what vessel passes through both foramen and sciatic foramen. Now, you also have the inferior gluteal artery, okay, which exits via the greater sciatic foramen at the lower border of the piriformis and emerges in the gluteal region to supply blood to the muscles in the gluteal. Okay. Now, in the male, you basically have the same branches of your internal iliac artery, except, of course, they don't have the vaginal. Okay. Instead, you have the inferior vesical artery. Okay, about the posterior group, you have basically three arteries coming from the posterior division. You have your iliolumbar, which moves upward, okay, along the lumbar vertebrae and along the iliac fossa, which gives rise to a blood vessel that supplies the iliacus muscle. You have the lateral sacral, okay, that penetrates the sacral foramina, okay, and gives blood supply to the meninges found in the sacral canal. And you also have the superior gluteal artery. This one is the counterpart of the inferior gluteal artery coming from the anterior division. And superior gluteal artery because it goes above the superior border of the piriformis. Again, it supplies blood to the gluteal region. Now, there are other blood vessels that enter the pelvic cavity, the ovarian or testicular artery, which are a paired branch of the abdominal aorta. Okay. your superior rectal artery, which is the third arterial branch of the inferior mesenteric that goes to the upper third of your rectum, and your median sacral artery, which is found at the bifurcation of the abdominal aorta into common iliac. Okay? Now, the veins in the pelvic cavity, okay, all branches of the internal iliac arteries are accompanied by corresponding veins. Okay? So, lahat ng mga branches daw from your division of the internal iliac or the posterior merisha accompany veins, and they basically drain to the internal iliac vein. Except your umbilical artery, okay, which has yung umbilical vein, you know that it does not, okay, drain into the internal iliac. So, iba yung direction na. Okay? Umbilical artery mo, the umbilical vein niya, of course, has a different direction. Okay? Now, let's go to the nerves, okay, found in the wall of the pelvis. Now, the nerves that are found in the wall of the pelvis form interconnections, or known as plexuses. Okay? So, in the true pelvis, the pelvic cavity or the wall of the pelvis, you have the sacral plexus of nerves. Now, these plexuses of nerves are not readily visible. You have the opportunity to dissect the pelvic cavity of the cadaver, no? Unless you pull away, no, the parietal layer of pelvic fascia. Okay, that's the only time that you will see these sacral plexus. Kasi when you go into the pelvic cavity of the cadaver, you will see that we have a sort of a shiny covering, no, of the interior of the pelvic cavity. That's basically the parietal layer of pelvic fascia. You have to pull it away from the so that, or dissect it away from the wall of the pelvis or the pelvic cavity to be able to expose this. Okay. Now, coming from the sacral plexus of nerves would be the sciatic nerve. Okay? It's the biggest nerve. Okay. Coming from L4, L5, and all the way from S1 to S3. Now, the sciatic nerve is like two nerves, no, found in a single trunk, where the posterior division, half of the sciatic nerve, will give rise to your peroneal nerve, common peroneal nerve, and the anterior division half will give rise to the tibial nerve. Then you also have your posterior femoral cutaneous, which comes from S1 to S3. Now, posterior femoral cutaneous nerve is sensory to the skin at the back of the thigh, all the way to the popliteal region. The other branches coming from the posterior division will be your gluteal nerve, superior and inferior gluteal nerves. Yung superior, mas mataas ang origin niya, L4 to S1. Yung inferior, mas mababa, L5 to S2. Piriformis, nerve to the piriformis muscle, and the perforating cutaneous nerve coming from S2 and S3. You have from the anterior division, nerve to the quadratus femoris, okay, which is also the nerve to the inferior gemelli, or gemellus, sorry, and your nerve to the obturator internus, which is also the nerve to the superior gemellus muscle. Coming from the anterior division also is the pudendal nerve, from S2, 3, and 4. Now, the pudendal nerve is a very important nerve, okay, because it is chiefly the nerve supply to the perineal region. It has motor, it has sensory branches to the perineum. So, ito yung nerve supply talaga to the perineal region. Okay? In fact, if you want to anesthetize, no, one side of the perineum, if you want to do episiotomy, no, during childbirth, you want to make an incision in the perineal region to allow the baby cell to pass through, no, more easily. Okay, you can block the pudendal nerve. You can block the pudendal nerve and anesthetize that side of the perineum. Okay, without having to instill lidocaine or anesthetic in the area of the incision. You can of course locate locate the pudendal nerve or its approximate position by palpating for the ischial spine when you do internal examination. Another from the anterior division would be nerve and the elevator anima cell and the coccygis and the perineal nerve coming from S4. Now, these are, other than your spinal nerves that go into the pelvic cavity, you have also nerves that come from the autonomic nervous system. You see here in green would be the sympathetic ganglia, okay? sympathetic ganglia. And from the sympathetic ganglia, you have your postganglionic sympathetic fibers forming the superior hypogastric plexus. Now, from the superior hypogastric plexus will come the left and right hypogastric nerve, which is made up of sympathetic fibers. Okay. Now, your pelvic splanchnic nerves, okay, pelvic splanchnic nerves coming from S2 to S4 will give rise to parasympathetic fibers. And the parasympathetic fibers from the pelvic splanchnic nerve will connect or will merge with the hypogastric nerve, okay, which is sympathetic, and form below your inferior hypogastric plexus of nerves, which is now a mixture. Okay, yung inferior hypogastric plexus of nerves is now a mixture of sympathetic and parasympathetic fibers to supply the visceral organs in the pelvic cavity. Okay, the rectum, the bladder, the vaginal canal, okay, the kidney, and so on. Okay, okay, so I think that would be it for our lecture. Unless you have questions.